Good afternoon and welcome to the University of Pikeville. We certainly want to express our thanks to each of you today for participating in this important discussion about substance use disorder and for your commitment to creating solutions from Appalachia for Appalachia. It's clear to me that in order for us to combat this issue, we must collaborate together so that we can move forward together. It is an honor for me today to welcome a national leader who is demonstrating his commitment to helping alleviate the substance use disorder epidemic, which has been devastating our families and communities for years. U.S. Senate Majority Leader Mitch McConnell joins us today for this important discussion. Senator McConnell was unanimously elected to his current position by his Republican colleagues, first in 2014 and then again in 2016. He is only the second Kentuckian to serve as the majority leader in the U.S. Senate. As the longest-serving Senate Republican leader and Kentucky senator, he was first elected to the Senate in 1984. In November of 2014, he was elected to a record sixth term, receiving broad support from across Kentucky and carrying 110 of the Commonwealth's 120 counties. In 2015, Time magazine named Senator McConnell one of the most 100 influential people in the world. He currently serves as senior member of Appropriations, Agriculture, and Rules Committees. He is the proud father of 3 daughters. Senator McConnell is married to Secretary Elaine Chao, the 18th U.S. Secretary of Transportation, and previously, Secretary Chao served for 8 years as the Secretary of Labor and President of the United Way of America. She was also Director of the Peace Corps. Please join me in welcoming Senate Majority Leader Mitch McConnell.
Well, thank you very much. Good to see all of you, and I appreciate the opportunity to be here to share my thoughts on this horrendous challenge that we're all confronting in our country, and in particular here in Kentucky and West Virginia. You know, I'm often asked what being the majority leader of the Senate's like, and I've struggled and finally come up with, I think, a good answer. It's a little bit like being the groundskeeper at a cemetery. Everybody's under you, but no one is listening. So what is it the majority leader gets to do that other 99 senators don't get to do? And that's the schedule. What are you going to do? And in the wake of this epidemic we've been experiencing across the country, I've had an opportunity over the last 4 years to schedule, to decide to do a number of things related to this epidemic that we hope will make a difference. As all of you know, this is not a problem that's confined to Eastern Kentucky. So today I'd like to discuss what we're doing to support your important work in response to the effects of opioid and substance abuse. First, I want to thank the University of Pikeville, SOAR, and Operation Unite for holding this conference. Each of these groups has shown extraordinary leadership in the fight against opioid and substance abuse at a critical time, and together they have an impressive record of achievement. I'm also grateful to be here today with each of you, the men and women who've dedicated themselves to helping their fellow Kentuckians. As we continue to push back against the scourge of opioid addiction, you all are the ones on the front lines, providing care to those in need, guarding our communities from the ever-present dangers, and lending a comforting hand to families in crisis. In the Senate, I frequently discuss this issue with my colleagues from all corners of the country. I had a number of members, for example, who ran for president in 2016. And as you know, if you follow presidential politics at all, it all starts in Iowa and New Hampshire. And I would have people coming back from New Hampshire saying, I'm running for president of the United States, and all the people in New Hampshire want to talk about is the opioid crisis. So that ought to tell you right there that number one, the problem's not confined to this part of the country, but everywhere. And so many members of the Senate are coming back, sharing heartbreaking stories happening in their particular states. You don't need to tell me about the widespread effects of opioid and substance abuse. You witness the impact of this epidemic each and every day, so you all are right there on the front lines. You have the important task of looking into the face of those struggling with addiction and helping them toward long-term sobriety. And your critical work helps stop drug abuse from spreading to the next generation. The significance of your efforts in our neighborhoods is really beyond measure. So I'd like to take this opportunity to thank each of you for committing your lives to building a healthy and safe Eastern Kentucky. Without you, this crisis would be a lot worse. Because of you and your work, we're making significant strides to fight back. When my longtime and good friend Chairman Hal Rogers helped establish the SOAR initiative, he knew it would be a success because of the vast potential of the incredible people of Eastern Kentucky. His vision is shaping a brighter future, and you're fulfilling that mission. May sound like a lot of responsibility because that's exactly what it is. We're all depending on you to fight for this region, to defeat this harrowing epidemic, and most importantly, to save lives. But you won't have to do it alone. We're working every day in the Senate to support your efforts. And like Congressman Rogers, I know that Eastern Kentucky is full of promising people who are working to make sure their neighbors and communities reach their full potential. Despite what may seem like nonstop partisan rancor coming from Washington, this is one area where members on both sides of the aisle are willing and ready to work together. I mean, we may have some big fights over things like judges and taxes, but not on this. We're all in this together. We continue to attack the opioid crisis from multiple angles, and we do it on a totally bipartisan basis. For example, just last month, the Senate passed an opioids bill by a vote of 99-1. That's my definition of bipartisan cooperation. The near unanimous support exemplifies the national urgency that we all feel to help tackle the problem. As the majority leader, I get to move Kentucky's priorities right to the top of every national discussion. That often means I can secure beneficial outcomes for our state, and I have made it a personal mission to deliver the resources, the programs, and the coordination needed to help those suffering with addiction. Ultimately, this crisis is more than just a health care issue. We've seen the impact of addiction on law enforcement, on communities, and of course, on the workforce. It's a comprehensive problem that demands a comprehensive solution. So let me give you a few examples of some of our work in the Senate to address the crisis. One of Congress' first moves to address the nationwide opioid crisis was the Comprehensive Addiction and Recovery Act, also known as CARA. That was passed during the last 2 years of the Obama administration. Totally, again, on a bipartisan basis. When this bill was signed into law in 2016, it bolstered prevention, treatment, and law enforcement efforts against the crisis. CARA, as it was known, also established a competitive grant program to give communities like Pikeville the tools to fight substance abuse right here at home. Fast forward, last month, the Trump administration announced that community health centers throughout Kentucky and as close as Prestonsburg and Whitesburg are getting a boost with hundreds of thousands of dollars as a result of that piece of legislation. Soon after passage of CARA, we passed another major proposal called the 21st Century Cures Act. It directed $1 billion over 2 years to combat the prescription opioid epidemic. Since then, Kentucky has received more than $60 million from the federal government to distribute for treatment providers, community health centers, and first responders. In fact, since I became majority leader, federal funding for our response to the opioid crisis has increased by 1,300%. 1,300%. What does that mean for you? It means facilities throughout the state are using that money to purchase naloxone, to hire more staff, to increase the number of treatment beds, and to fully equip themselves for the fight. In short, it means we're doing everything we can to help you in your work. You all are the experts, and we want to provide the resources, the tools, and the training so that you can save lives. As I mentioned, Congress just recently passed another landmark bill in the fight against opioid abuse. It combined proposals from more than 70 senators. 70 senators had a part in putting the bill together we just passed a few weeks ago. Two of the provisions I wrote with input from 5 separate communities here in Kentucky. It's sort of like a Swiss Army knife that will help fight the opioid epidemic in several different ways. And when President Trump signs it into law tomorrow, it can deliver real help for those who need it the most. It's called the Support for Patients and Communities Act, and it's full of innovative ideas to advance treatment and recovery initiatives. In addition to establishing new grant programs and expanding access to treatment, I want to mention a few items in this opioid package that will be of particular interest to you. Congressman Rogers supported a new loan repayment program for healthcare providers who work for up to 6 years in areas especially impacted by substance abuse, like here in Pikeville. Many of us recognize the dedication and compassion necessary for you to stand in the front lines of this epidemic, and we wanted to support you in that mission. You're bearing a heavy enough burden in this work. Your student loan debt shouldn't be yet another. Another innovative idea comes from my Kentucky colleague, Rand Paul. As a physician himself, he was able to bring a helpful perspective about how to give you the tools necessary to succeed. Senator Paul championed a plan to contribute to recovery and give new types of practitioners the ability to put their skills to work. He also led the change to increase the impact of a single physician so you can become a force multiplier in areas that need the work the most. So I want to thank my Kentucky colleagues for making it easier for providers like you to treat patients and promote recovery. As I mentioned before, 2 of my provisions were included in the legislation. I was proud to author the Career Act, which aims to address the crippling consequences of addiction on the workforce. My colleague Andy Barr introduced my bill over on the House side. The Career Act encourages employers and treatment professionals to collaborate to support individuals in recovery as they transition back into the workforce. It also promotes transitional housing services for people in recovery until they can find a stable situation. You've likely seen in your work that when individuals in recovery have steadiness in their lives, from a good job with a safe place to live, the chances of their long-term sobriety increase dramatically. The other measure I included in this new law is the Protecting Moms and Infants Act. In 2015, I sponsored the first federal law to address prenatal opioid exposure, directing federal agencies to develop strategies in response to the tragic increase of babies born from mothers abusing drugs. My new provision goes further and instructs the federal agencies to report on their implementation of treatment guidelines. It also authorizes increased grant resources to help organizations battling this particularly troubling problem in our society. We're making strides in the fight against opioid abuse, but I know that a single piece of legislation is not going to solve this crisis in Kentucky or across the nation. It'll take continued collaboration from all of us, healthcare professionals, law enforcement officers, families, community leaders, and government officials. This, of course, is not the end of the conversation. When you have ideas on how the federal government can help, I want you to let me know. I'll continue supporting providers, treatment experts, and first responders until we can keep our communities safe from the dangers of drugs. If you're interested in applying for these competitive federal grants, I'd like to know about it. My office stands ready to help with guidance and letters of support. Contact my staff either in London, over here southwest of you, or in Washington, and we can work together to help bring the resources you need to Kentucky. It will take all of us with new ideas and strategies to fight back against the disease of addiction. I've been inspired by many of the solutions that have come from right here in Appalachia. Earlier this year, I had the opportunity to meet with students from Ashland Middle School for a class project. You may have heard about this. For a class project, this group of youngsters decided to help clean up the dangerous needles discarded around their school. They talked to their teachers and local law enforcement. These young people used a 3D printer to develop a prototype device that can safely pick up a used needle and deposit it into a sealed container. Their teacher entered this design into a national competition. This is middle school. The teacher entered it into a national competition. They won. They won. So these future leaders from right here in eastern Kentucky went on national television with their ideas to keep their community safe and to fight the opioid crisis. I think it's a pretty powerful story. I'm sure you agree. And I hope it motivates all of us to keep standing up to addiction. The future is bright because we have leaders here today with the drive to make Kentucky a better and safer place to live. And so let me conclude as I began by thanking all of you on the front lines carrying the fight forward to help us end this epidemic once and for all. Thank you so much.